Greetings, judges, YouTubers, fellow Americans. My name is Brent Ewig. I am the Director of Policy and Government Affairs for the Association of Maternal and Child Health Programs, and it's our pleasure to describe our submission to the U.S. Data Obesity Challenge. What we put together and have shared via our submission is an infographic, a visualization, if you will, of some key data that we hope can be a tool for public health officials and advocates to drive a conversation with policymakers about the essential need for investment in population-based public health approaches to address the particularly childhood obesity epidemic. What we did to achieve this, if you take a look please, is try to do using NHANES data from the CDC and the current population survey from the Census Bureau, tracking over the last several decades how, if you can see, the historic decline in the childhood uninsurance rate has occurred at the same time that increase in childhood obesity rates was unabated. And the goal here is not to in any way undermine the importance of health insurance coverage for children. We would submit that that's essential, fundamental, and vital to our nation's health. However, the goal intent here is to help illustrate what in public health is pretty much a well-known given, that there are limits to medical care, and those limits need to be complemented by population-based public health approaches. And I think what we have here is a hopefully striking and provocative illustration that while we spend tens of billions of dollars to drive this number down, the amount of investment in addressing this number has not clearly been sufficient to drive the progress we would all hope. So converting that into an infographic, we tried to make this presentation, as you see, raising the issue of are we prioritizing prevention. And again, the data to show that the U.S. annually spends $77.5 billion of public funds to support children's health insurance through the Medicaid and CHIP program. And yet the entire budget of the CDC's Chronic Disease Center is only $1.2 billion per year. So 64 times the amount we spend on publicly financed health insurance than we do on publicly funded population-based approaches, at least at the federal level. And getting behind the number a little bit, I think most people would realize the entire budget of CDC's Chronic Disease Center doesn't exclusively go to address obesity. In fact, the obesity line item is much smaller, perhaps only $60 million in the obesity, nutrition, and physical activity line of the Chronic Center's budget, although recognizing many of the Chronic Center's programs do address obesity as a primary risk factor in other chronic diseases. So that is our presentation of the data. And again, the intent here is to not in any way undermine the importance of health insurance coverage, which again we would submit is essential, fundamental, but in this case clearly not sufficient to drive the types of public health improvement we want on an issue as important as childhood obesity. So we appreciate your consideration. We hope this is a useful tool. We again use the CDC National Health and Nutrition survey data from CDC and the the Census Bureau's current population survey to track the health insurance trends over time, and then the budget information is derived from both the CMS actuary for health insurance and the CDC's budget justification submitted to Congress is where those numbers come from. Again, my name is Brent Ewig from the Association of Maternal and Child Health Programs. We are pleased to submit and hope you appreciate our attempt to provide a useful infographic to drive policy discussions around the importance of prioritizing prevention to address obesity. Thank you very much.